What is scoliosis? In order to have a diagnosis of scoliosis, there are certain parameters that have to be reached. First thing, there has to be an unnatural sideways spinal curvature must already have been developed. And this spinal curvature needs to have a rotational component associated with it. And the rotational component is normally into the concavity of the curve, making it truly a three-dimensional problem. And when they measure the angle or the Cobb angle of the scoliosis, it needs to be 10 degrees or greater. Now, the Cobb angle is the gold standard to assess scoliosis. And this is a measurement that's taken during a scoliosis x-ray. And typically a scoliosis x-ray is an x-ray that's taken either from the front or from the back that includes the entire spine on one x-ray, the lumbar spine, the pelvis, the thoracic spine, and at least up to the base of the neck. And when they look at the scoliosis or the curvature, they take the most top tilted bone above and the most top tilted bone below, and they draw lines. And these two lines intersect, and they measure something called a Cobb angle, and it's measured in degrees. The larger the Cobb angle tells a scoliosis provider how severe the scoliosis is. In this curve, from in between the most tilted bone above and the most tilted bone below, is the most horizontal vertebra, and this is called the apex. And the apex tells you the location of the scoliosis. So if the apex is in the thoracic spine, it will be called a thoracic scoliosis. If it's in the lumbar spine, it will be called lumbar scoliosis. And if it's in between the two, it will be called a thoracolumbar scoliosis. But when we take the Cobb angle, that's what determines the severity. Now, the Cobb angle, meaning the size of the angle alone, determines severity. There is no other consideration taken, meaning the impact it has on the body or how much pain the person's feeling. So this is only looking at the size of Cobb angle. Curves between 10 and 25 degrees are considered a mild scoliosis. Cobb angles that measure between 25 and 40 degrees are considered a moderate scoliosis. 40 degrees or greater is considered severe, and then 80 degrees or greater is considered very severe. Treatment plans are normally crafted around very important variables such as size, location, patient's age, and so forth. So therefore, understanding and classifying a scoliosis correctly is also important. When we look at prevalence of scoliosis, we know the Scoliosis Research Society puts anywhere about 6 to 8 million people living with scoliosis in the U.S. alone. Scoliosis by far is the leading spinal condition among school-aged children. And unfortunately, the treatment of scoliosis that has gone to severe stage is scoliosis surgery. And scoliosis surgery is a very expensive, very invasive treatment that could affect patients' lives from that moment on. And by definition, it is something called spinal fusion. And spinal fusion will always limit spinal function because the spine is designed to move. So if you fuse it, it's a non-functional approach. A lot of times I get asked questions is, will my scoliosis get worse? Well, scoliosis is almost always progressive. What we don't know is how fast it's going to progress and how big it's going to progress, but we almost always know at some point it will progress. Scoliosis, in its very nature, is to worsen over time. So particularly if it's left untreated or not treated properly. Where a scoliosis is diagnosed at it's not indicative to where it's going to stay or what would mean it not worsen. Every severe curve was once moderate. Every moderate curve was once mild. So we know all curves start off small and they progress over time. And only proactive treatment can counteract the progressive nature of scoliosis. So therefore, just because somebody was diagnosed with a mild scoliosis does not mean it's going to stay there. When we look at scoliosis, we know there's different types. And the most common type is adolescent idiopathic scoliosis that's diagnosed between the age of 10 and 18. And this is the most prevalent diagnosis when we think of scoliosis. Idiopathic means unknown cause, and this is where 80% of diagnosis scoliosis occur, is in this stage. 80% are all diagnosed as idiopathic cases. The remaining 20% have known causes, like a neuromuscular condition could be associated with the scoliosis, some kind of congenital hemivertebra associated with the scoliosis, degenerative scoliosis that happens in the adult stage as a result of degenerating spine as a result of alignment or trauma, and then there's severe traumatic scoliosis that initiates the scoliosis very quickly. Now, even though we look at these other 20% and we think of adolescent cases being the most common diagnosis we find, We know it's not the most common age group of scoliosis. The most common age group is actually in adults 60 years or older. We think it's like 30% of all adults 60 years or older have some form of scoliosis. The problem is between 20 and 60, most patients with scoliosis, they kind of function okay. They get by. If they have any kind of discomforts, they kind of do mild things to help themselves. But then they normally hit a point where what they're doing no longer helps them anymore, and they get this diagnosis. Well, then scoliosis is what's causing your problem because it's worsened over the time, and they're dealing with the severe effects of an adult progressive scoliosis. So even though we see scoliosis across this entire age group, we know scoliosis is a very complex problem that requires a customized treatment plan. And at Scoliosis Reduction Center, we offer proactive treatment plans that integrate multiple forms of treatment, from therapy to rehab to chiropractic care to scoliosis specific exercises to corrective bracing, to influence the scoliosis either as an adolescent, an adult, or late stage adult, whether it's where you're feeling pain from it or not, whether it's mild, moderate, or severe. But one thing we do recommend for all scoliosis patients, that the sooner the soon as you diagnose it and the sooner you treat it, the more effective treatment you're going to have when it comes to conservative treatment, because conservative treatment wants to use the inherent recuperative powers of the body to make the body function and heal better. So therefore, treating it at a small number can produce a much better result later on in life. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.